Now, to visualize the complication of premature rupture of membrane, we need to actually know the pathophysiology. Is it clear? To visualize the complication of premature rupture of membrane, you need to know the pathophysiology. So now let's start with the pathophysiology of premature rupture of membrane. We need to know that this complication of premature rupture of membrane are going to be associated with one, we have a reduced amniotic fluid. Complication associated with reduced amniotic fluid. Is it clear? Now, the complication associated with reduced amniotic fluid, you need to know that what? Generally, the amniotic fluid is both beneficial to the fetus and the mother. Is it clear? So we have beneficial to the fetus and the mother. Is it clear? So generally, a reduction in the amniotic, there is going to be pathophysiology for reduction in amniotic fluid, and there is pathophysiology for a portal of entry. Is it clear? So there are two major pathophysiology. The pathophysiology of reduction of the amniotic fluid is mostly going to affect the fetus, while the pathophysiology for a portal of entry is going to affect the mother. Is it clear? So those are the different elements. Now we need to know that what generally when there's a pathophysiology from port of entry, meaning that what since there's rupture of membrane, it means that the bacteria which are normally located in the vaginal mucosa, is it clear? Because you need to know that there are actually plenty bacteria in the vaginal mucosa which can ascend up to the chorion, the amnion, and the uterus of the mother in order to cause infections. Is it clear? When there is that portal of entry, the major complication that we are afraid of in this case is infection. Is it clear? Of the mother. Is it clear? So that's why on the we are going to ask you to do certain tests in order to see that those complications do not occur. And you do also management to prevent those complications from occurring. Now, for the fetus, you need to know that what amniotic fluid generally help to prevent bacterial growth. So it's going to prevent infection of the fetus. Is it clear? Normally, amniotic fluid is going to prevent bacterial growth, so a complication can be infection. Second complication, amniotic fluid help in lung maturation. Is it clear? Is it clear? And the normal functioning of the lung, so in lung maturation. So in this case, you can easily have a lung hypoplasia. That is a complication again on the fetus. The next thing is also helping the musculoskeletal maturation. So you can have dysplasias of the musculoskeletal system. Dysplasia of the musculoskeletal system. You can have also amputated limbs. Is it clear? You can have amputated limbs which can occur as a result of oligohydramnios. The fourth element, it can also help in the GI tract maturation. So you are going to have duodenal aplasia. You can have duodenal aplasia provided this oligohydramnios in the early cases. Is it clear? The fifth one, it's also associated with temperature regulation. Is it clear? And temperature regulation is also a very important element that is going to help in the viability of the child. So that's why the child is going to have an acute fetal distress. Is it clear? The child is going to have an acute fetal distress that you also need to evaluate that in your history and your physical examination. The sixth element of the role, it also helps in the kidney perfusion. That's why the child may have an acute kidney injury. Is it clear? Or renal failure. The seventh element, we are going to also have what? It also helps in the Cushing of the child. Is it clear? So if there is also a problem of the Cushing, there's direct contraction of the uterus on the child and not on the amniotic fluid. It can also result to an acute fetal distress, also with an intrauterine growth retardation. Is it clear? So those are the different elements that you can have as complication of the fetus as a result of these mechanisms. Is it clear? Now, what are the presentations? So generally on the mother, for the infection, the mother is going to present with a fever. Is it clear? On the review of system or the physical or the present complaint, you can have fever. Is it clear? And when you take the temperature, the hallmark is going to be the temperature in fever where you have a hyperthermia, meaning that the mother is already infected. Is it clear? And you are going to have a point of focus of the infection. So generally, to know the diagnosis of sepsis is to have the SIRS. On physical examination, you are going to have SIRS, systemic inflammatory response syndrome. Is it clear? And you have a point of focus. In this case, you have a premature rupture of membrane. That's why it is your point for focus. And you have a SIRS. Is it clear? You may also visualize for local lymphadenopathies in order for you to know if it has started from this point of focus up to the systemic inflammatory response by passing through these lymphadenopathies. That is why when you try to palpate at the level of the inguinal region to find if there are tender lymphadenopathies. Is it clear? You're going to visualize tender lymphadenopathies, which is going to tell you a local spread before a systemic spread, which is going to be a systemic inflammatory response syndrome. And the characteristic of this systemic inflammatory response syndrome is that you are going to have a tachycardia. Tachycardia generally consists of greater than 90 beats per minute, but some people consider as 100 beats, greater than 100 beats per minute. You have a tachypnea of greater than 22 cycles per minute, greater than 22 cycles per minute, and you have a temperature of either less than 36.5 or greater than 38.5 degrees Celsius. Plus, you have a leukocytosis of more than 10,000 white blood cells. Is it clear? So those are the different with neutrophilic predominance particularly. So those are the different elements which can tell you that there is sepsis. This is a systemic inflammatory response syndrome with a point of focus. So that is going to conclude on the infection. After the infection, you can also visualize the infection of the child. Is it clear? On physical examination, you cannot know if a child is infected directly on physical examination. It's only when the child is going to be born that you're going to examine the child before you have the signs of infection. And a peculiar sign of infection is still fever, but we have an additional sign of jaundice, particularly in a child. Is it clear? Because infection is associated with a hemolytic process. Is it clear? And then the children do not have a mature liver, or they have too much red blood cells, and that is why it results to excessive jaundice. And particularly in children, when there is bilirubin, that unconjugated bilirubin can be accumulating in the basal ganglia of the brain, resulting to a disease called kernicterus. Is it clear? So it is always why you should prevent this jaundice in children by giving them phototherapy. Is it clear? With blue light. So in long maturation, we have long hypoplasia that you can use surfactants in order to mature. We have musculoskeletal dysplasia that can result. All these are mostly complications that are going to be treated in the cases of pediatrics. But now the complication that can be treated here is acute fetal distress. Acute fetal distress can be visualized on physical examination with the mother first telling you that she has a reduced cardiac count to 10, meaning that in every 12 hours she counts the fetal movement is less than 10 movements per 12 hours. It means that there's a reduced cardiac count to 10. Is it clear? On your review of system. And then the next point again, on the physical examination, you realize that the fetal heart rate is either fetal bradycardia or fetal tachycardia. But I've told you that the best measure for acute fetal distress on physical examination is the fetal variability, which can be visualized with the cardiotocograph, but we don't have it in our context, so we are going to use only the fetal tachycardia and fetal bradycardia to help you to know if there's acute fetal distress. Yes. So to visualize acute fetal distress, another element still, the amniotic fluid is going to be meconial stain. You can also tell that there's an acute fetal distress. All those are the elements on physical examination to visualize that. And for intrauterine expression, if the restriction, the physical examination element is going to tell you that there is going to be small sinusoidal height for gestational age, but this should not impair you, because the small sinusoidal height may be as a result of the oligohydramnios, which has result from the premature rupture of membrane. Since there's rupture of membrane, there may be oligohydramnios, so it should not confuse you. Is it clear? So those are the different elements that you need to visualize in this case. So after visualizing the complication of the premature rupture of membrane, we now go back to visualize the presentation of preterm labor and the complication of preterm labor. Thank you.